Welcome, everyone. Good afternoon. I hope all of you are staying safe and healthy. Thank you for joining us for today's AMO Beacon webinar. I know that time is valuable during these days of working remotely, and we really do appreciate you tuning in to hear about AMO's partnership with Beacon and how their digital platform can help you, your staff, and dependents access effective mental health care. My name is Nick Reuter, and I'm a research advisor with AMO and LAS. I know you've heard it all before about living in extraordinary and unprecedented times with the ongoing COVID-19 pandemic, but this continues to be true. While we are doing our best to curb the spread of the virus through working at home and other physical distancing measures, this can create feelings of anxiety and uncertainty that will test our mental well-being. As elected officials and municipal staff, you are playing a vital role in responding to this emergency, managing your local services in difficult times, and providing leadership in your communities. Your residents look to you to manage through this crisis and rebuild in its wake. And these challenges will be met, but more important is ensuring that you, your colleagues, and your family have access to the appropriate mental health care supports through these difficult times. AMO is here to help. Back in March, we launched our partnership with Beacon, a digital mental health care solution to provide members, their employees, and families access to quality and effective mental health care therapy through the convenience of a personal device like a smartphone or a tablet. The Beacon approach is therapist-assisted, internet-based cognitive behavioral therapy delivered privately and securely through the digital Beacon platform. AMO is pleased to be offering this digital solution to members, which aligns with the provincial mental health strategy, particularly on innovative ways to provide mental health therapy and create positive mental health outcomes. And our speakers from Beacon will shortly go into more detail on how the program works. And I know that there are a few of my AMO colleagues on the webinar today, and I'm pleased to say that as of last week, AMO is offering the Beacon service to our employees as well. And with that, I will introduce our two speakers. Colin Anderson is the Executive Vice President of Mind Beacon Health, and many of you are probably familiar with Colin with his time as CEO of the Ontario Power Authority and as former Deputy Minister of Finance and Acting Deputy Minister of Health and Long-Term Care, amongst other sundry portfolios. And joining him is Anthony Sam, Business Development Director at Beacon, who has previous business and financial experience in roles with Cubic Health, CCM Consultancy, and with Investors Group Financial Services. So without further ado, I'll hand things over to Colin and to Anthony.
Thanks very much, Nick, and thanks everyone for tuning in to the session today. So I think what I'm going to introduce Colin. So Colin, if you can take it away over here, I'll just go to the slide that we need to get to. So the agenda is very quick in terms of the overview of Beacon and then Beacon for municipalities. So I'll hand it over to Colin to take it away.
Great, thanks Anthony, and thanks Nick and Judy and Pat before that. We've been working on this project for a long period of time. This is actually our second webinar on this subject, and thank you to everybody who's joining today, and also thank you for all the great work, the tough work that you're doing during this particular period. As Nick mentioned, I was formerly a deputy minister with the Ontario government. I now head up all of the public sector side of the practice. But also have a personal interest in what we're doing at Beacon. My father was bipolar and my mother has an anxiety disorder. So I have a personal interest as well as a professional interest. And I'm an economist by training. So seeing people get back to work and operating as productively and as effectively as they can is a significant part of my interest and also the mission of the company. I'm actually in the Rossmore area today and have been for a while now. So I noticed there was somebody on the list from Belleville at one point, so just across the bay. So hello to everybody across the province. So I'm just going to do a couple of quick slides to give you some context setting. The top of this page talks about some of the stats that we've seen historically in a pre-COVID world. So 1 in 5 Canadians experience a mental health problem or illness each year. Unfortunately, 2/3 of those who could benefit aren't getting treatment that they could benefit from for the reason being a wide variety of barriers, most commonly being affordability or cost, no available counselors in their area, so accessibility a big challenge, scheduling time off to go to work or from work to go to appointments, those kind of things can be very, very challenging. It all adds up to about 500,000 people across the country being off work every week due to a mental health issue. So a staggering number of people, significant burden on our economy. And a good chunk, as many of you on this call would be aware of, those of STD claims, short-term disability claims, have a mental health issue involved in them one way or another. With the onset of COVID, Health Canada put out some stats that about 11 million people, Canadians, are going to experience high levels of stress, both in family and work. We all know what it's like being in homes with families, especially as this time goes on and we're trying to work at the same time. 2 million Canadians will actually show signs of traumatic stress, so elevated or higher level of stress. This stat is actually a little bit outdated. We were seeing a 3 times increase in volume a number of weeks ago. We're more up into the 5, and for some things 10 times an increase in volume. And one of the other lessons that we know from SARS and from other global crises is that the psychological impacts of the crisis are actually going to last much longer than the immediate social distancing period as well. So we, the company, we're an Ontario-made program. We're available coast to coast to coast in both official languages, but we were designed, developed, and all of our data is housed right here in Ontario. It stays in Canada, doesn't go to the US or the UK like some other programs. Our history is grounded in a network of face-to-face clinics called CBT Associates. And we use those clinics to actually develop the BEACON technology, which you will learn more about in a few moments. So I'm not going to go into a lot of details about the BEACON product and platform itself. But on a high note, at a high level, so what I said, I head up the public sector practice. So currently, we have projects in place with CAMH and Ontario Shores, the 2 largest mental health hospitals in Canada, both for employees as well as patients. And so it's a good indication of their endorsement that they're treating us both, they're trusting us both with their own employees as well as their patients. We have a number of other projects at hospitals to work with them on their wait lists. We are working on campuses. The government had announced a Mindability program just shortly before all the COVID situation happened. We've been working with them on the post-secondary component of that. And then last week, the government of Ontario announced that MindBeacon is available to everybody in the public across the province during COVID by going to the Ontario government website. So it's a time-limited program. We don't know how long the COVID experience will exist, but it is available now through them. And also of note, just yesterday, in fact, the Ontario government launched a program for their own employees. So concurrent with the public program, they've introduced a program for their own employees. It's a subscription program, so they obviously see the value in launching an ongoing permanent program for their own employees that will last beyond the COVID period. They see the benefits that they get with better reporting or more reporting specific to their organization, targeted communications, insights into their own employees, and that kind of thing. So that gives you a very high level of some of the kind of projects that we've got going across the province, and in fact, we've got variations on that theme across the country, all levels of government we've been working with. So with that, in the interest of time, I'll turn it back to Anthony to carry forward.
Thanks so much, Colin, for that introduction and providing us a little bit more insight into regarding CBT Associates and BEACON. And I'll just also touch in terms of my interest is, from my point of view is, the BEACON provides exceptional, support to not only Ontario, but also the whole of Canada. And I joined because my wife actually works for the Centre for Addiction and Mental Health and been there for about 20 years. So that's, personal side on my side. So I'll go on to, in terms of looking at, the type of the barriers that we see regarding mental health. And just to give you a little bit of context, cognitive behavioral therapy is the most validated and credible way to address mental health conditions through therapy. And the traditional way, is very expensive. It takes a lot of time, and it's very restrictive in terms of time and from a geography point of view. And, if you can think about it in terms of if you have an employee, let's say out in Northern Ontario or rural area, where they are dealing with a major depression, and traditionally they would have to go out and find a psychologist, pay out of pocket, and perhaps put it through their benefits, which is very expensive. CBT, what this allows them, it allows them to get access, the same level of quality, effectiveness as in-person therapy at 20% of the cost. So instead of that traditional in-clinic appointment, the cost of that cost of about $2,500 to $3,000, we're doing it for a fraction of the cost of $500. And I will note that it's the same type of quality and effectiveness. So that gives you, in terms of the challenges that people are dealing with, from the stigma, the cost, the geography, and also the resource availability. Now, what is BEACON? So BEACON, what we do is all clients have immediate access to an online assessment. The treatment is very much over a 12-week period, but typically we see individuals go through the treatment between 8 to 10 weeks. And they have access to all the material that they've reviewed over, beyond that 12 weeks, which goes on to 40 weeks, which is what we call passive therapy. And they are working with a registered professional. So in order to, if you take a look at it from this way, it's a combination of clinicians, there's technology involved, and it's delivered, and the CBT is delivered. In the background, we have clinicians that tailor-make the therapy for our clients, although it is driven by technology. The core principle of CBT, of the in-clinic service or dedicated therapists with asynchronized messaging, with all the intellectual capital that is built into the platform. And that is what we call ICBT. And as I mentioned, it is the ICBT is 20% of that traditional cost. So in terms of how BEACON actually works is during this process, so we go through a 7-step process, and there's a significant amount of information that we do collect about these individuals from the start of assessment. Every step of the way throughout is the information that we get is strictly confidential. The client is paired up with a dedicated therapist from the start of the therapy to the end of therapy. At the same time, it's all very much tailored. It's customized to the individual's needs, and it is evidence-based. And at the same time, for example, if an individual comes in on the platform, once they completed assessment and the therapist recognizes that the client needs to go on a depression protocol, we see about 95% of individuals, even though they're on one protocol, they do perhaps have challenges in terms of anxiety, and that's when our clinician can add different readings or modules for the individual to practice, the areas of anxiety. So it's not one cookie cutter. It is, we do pivot to ensure that the client is taken care of. As I mentioned earlier, the therapy is very much, over a 12-week period, but what we do typically see is individuals, completing their therapy within between 8 to 10 weeks. So 8 to 10 weeks, the individual is then discharged. Now, they do have that opportunity to go back into into the platform to review any type of exercises or readings for a 40-week period beyond those 12 weeks. So that gives you a very good idea in terms of how Beacon works. Now, if we look at the current protocols that we do work on, there's 8 protocols. Specifically, the last one I'll just add in terms of the new release, which was released just during the early on during the COVID-19, and we've seen a significant amount of uptake in that particular area. As well as, from on the right-hand side, you will see that in 2020, we are working on a significant amount of other protocols. And as we hear from our clients, we do, develop them on an ongoing basis. So this, we do look at it and ensure that we do respond to our clients. One area that I do want to just touch on is the resilience and stress management. While we don't have a protocol per se, we do have a significant amount of content that we've developed over a period of time, specifically due to this COVID-19. And also, for first responders, we are working on some content for first responders, and I believe that Colin is very much involved in that area. Now, some of you may have also heard through whether it be AMO or media that we launched Stronger Minds back on April the 6th. This is a free program to all Canadians across Canada. And this is one way that the senior executives at MindBeacon wanted to give back to Canadians. So this is a free program where individuals can watch timely videos, there's quick reads, there's activities to help gain resilience. And you also hear directly from our clinicians where they do provide videos on a weekly basis. So if this is something you are interested, you can send me a note, or else go on to you can Google this and you'll be able to find it. So what is it that, in terms of we do for Canadians from an intervention point of view? So there's a few areas that we do work at. And the first one is we want to ensure that, we are there at an early intervention. And the earlier we're able to intervene with individuals, the better. Because as Colin touched on earlier is, when you're able to engage these individuals that are looking for help, over the long period of time, short-term absenteeism decreases, short-term disability, as well as long-term disability decreases. As well as, we do have, as I mentioned earlier, is the first responders and frontline individuals. Obviously, some of you on the call today do have these the first responders within your municipalities. So this is something that we are working to provide a significant amount of support for them. From a disability management point of view, we also look at return to work or help individuals to stay at work. Chronic disease, comorbid conditions, which I'm sure everyone's heard that term, of individual working through chronic disease and they may be suffering pain. And then, as Colin also alluded to earlier, we are working with post-secondary organizations around in Ontario and a few out in the Atlantic area. And then the healthcare, I'll just touch on that, is we are working with Centre for Addiction and Mental Health, as well as Ontario Shores, and also a few hospitals in Ontario. So that gives you a good idea in terms of the work that we are doing for Canadians. Now, this just gives you a quick overview, which, early on, I know that, Colin played a big part in this, is to ensure that we got that rubber stamp from an organization like CADIS. It's very much an organization that looks at all the drugs out there, all the treatments, and we got that rubber stamp from them, as well as the health quality of Ontario. So, it is, we're very proud of this, and we continue to work to get better on a daily basis. I wanted to just share with you a little bit of results that we've seen from our program. And I want to, just turn your attention to that heat map per se. And what that heat map really shows is, from individuals starting therapy, when going through therapy and being discharged from therapy, which is where the severity at the end. And as you can see, the 7% at the bottom increases to 33%. So that's really saying that individuals are feeling better after going through. And these individuals are on that subclinical level. And one thing to note, and we've also had this question quite often, is, you know, how severe of a mental illness per se does an individual have to have, and how effective it is. And the reality is that individuals can be mild, moderate, severe, and when they do go through the platform, these are the results that we are seeing. And then on the left, in terms of the mental health improvements, 80% of individuals, you know, once they go through, they feel that there is a significant amount of improvement. At the same time, I wanted to give you a little bit more insight in terms of our PTSD protocol. So the PTSD protocol, you know, there is significant amount of evidence, and here is proof in terms of, you know, what we've been doing as well as our results. So as you can see, the, you know, severe, moderate, and mild, you know, the results that we are seeing with this protocol. And this is specifically, it is, you know, works really well with the first responders. And if anyone is interested, we do have a white paper, research paper by our Chief Science Officer, Peter van Grovel. Some of you may have heard that name. Feel free to send me an email. You'll get my information right at the end. I'm happy to send that information over to you so that you can review it. And to give you a little bit of facts and figures in terms of the type of people or people that do come on board, you know, we have 107 people from different countries, 107 different countries. And interesting to note that 52% of individuals have engaged of some type of therapy in the past. And then the 91%, which I did touch on earlier, is they have comorbid conditions, whether it be, you know, they may come on a depression protocol, or may have to add, you know, some content on the anxiety side. So gives you an idea that, you know, this can work for many individuals. One of the areas, or one of the questions that we also get, this is a very common one, is in terms of, well, we have EAP, a program, and how does BEACON fit into this? Well, the reality is, these are the 5 things that we can touch on very briefly. Is EAP is very much family counseling or short-term, whereas BEACON, you know, it is specific to treat mental health. The second one, that, you know, in terms of, you know, the intake, is we do provide an assessment based on the DSM-5, whereas with the EAP, there's no standardized assessment. We do offer, you know, once the individual has completed the assessment, there is a diagnosis where they work, and then they work with a dedicated therapist, whereas with EAP, there's different, that they can't differentiate in terms of the diagnosis. So, you know, those are a few type of differences. And the last one I would say is, there's no consistent evidence in terms of EAP, whereas with BEACON, we provide evidence-based therapy, and it is very much quantifiable results. So, you know, at the end of the day, you know, people, you know, there's a lot of people consuming the drugs as well as, you know, for example, the ongoing disability costs. And those are the 1 in 5 that we are dealing with, that have a significant health problems. So what organizations do, you know, they have the health and wellness programs, and all those great things, as well as EAP, and the rest of it to help, you know, the 1 in 5 or the 1 in 5 from happening. And the reality of all this is that the 1 in 5 is never going to go away. They're always going to be there. Now, the question we got to think about is that 1 in 5, when they reach out, you know, we know from just looking at the slide, that EAP is not there to help that 1 in 5. EAP is very much there to help that 4 in 5. So, you know, we focus on the people with that mental health conditions that are, you know, driving those costs of the drugs, the disability, and the things that they're dealing with from a chronic condition point of view. And the only way we could deal in the past, you know, in terms of looking at this, is they would have to, you know, pay out of pocket and then go see a counselor. Now we're offering this alternative at 20% of the cost, and that eliminates that time and geographic access that I mentioned earlier. So that, you know, provides you a good idea in terms of the differences between EAP and BEACON. Now, what's in it for, you know, everyone on this call from a municipality point of view? So once we do go through, you know, in terms of discussing a little bit more, and municipalities do come on board. And since the launch of the program, I'll just give you a bit of stats, is we've had a significant amount of, we've had number of the municipalities come and seek information. Some of them are still in the decision stage, but we did bring on one municipality very early on, and their results are pretty strong. And we do see the uptake of this particular program. So what they received, or what municipalities would receive, is they would receive a web page for the employees, and you also get a dedicated client account executive to assist from the area of providing you that support, which is support, whether it be from a mental health engagement tool, sustainable awareness, mental health milestones, as well as webinar series that we're able to host for you, whether it be over during the mental health week, or if you have a specific day in mind, we're able to assist you from that point of view. So, it's very much a turnkey per se, but we do provide an account executive that is there to assist you every step of the way. So what's in it for municipalities? It's very much, to reduce that absenteeism, and the ROI factor of 11 times the ROI factor in presenteeism, and then additional savings from the benefits, claims, and turnover. And as I mentioned, those 1 in 5 people, that 1 in 5 also, those are the individuals that are using a significant amount of drugs. So once they engage with the therapy, as well the therapy, we do see hopefully those drug costs will decrease over a period of time. For the municipalities and their families, so it's the municipality, the employees, as well as their families, it is very much confidential, it's very convenient, and it's 24/7. There's no waiting list, there's no appointment, so people don't need to prepare for an appointment or go see an in-clinic service. It is based on internet, or individuals can even do this all over a smartphone. So that gives you an idea in terms of what's in it for the municipalities as well as their employees. Now, I want to give you a bit of context regarding this particular slide. And what this really shows is there's two ways individuals can really access our services. The first way, which we see from which we've seen, is individuals can go seek psychological services. Then once that service is complete, they'd have to pay for it first. So they would pay for it on a credit card, and then they would have to go back and claim for this particular service through the benefits. And the uptake that we see is 0.13. So this number that I'm circling, 0.13%. Whereas when an organization decides to invest in the employees and make mental health a priority and pay for each individual, so pay for it per employee, we see the utilization rate increase by 25 times greater to 3.24%, as you can see on our slide. And we've tested it, with multiple organizations, and every time we tested, the results are pretty much the same. So this is a great opportunity for everyone listening, municipalities, that you invest in those employees and give them the access to this program. Instead of, we all know, during this COVID-19, individuals may have challenges with regards to first the mental health aspect, but also from a financial aspect is, there's a lot of layoffs. We all know there's a lot of layoffs, and we continue to ensure that we're able to help the individuals within not only Canada, but also at the municipality level. And then we look at, virtual therapy in terms of return. Specifically, the guided CBT yields $3.35 for every dollar spent by an employer. And this, some of these sources are from Deloitte Canada, as well as the Center for Addiction and Mental Health. So that gives you a good idea in terms of the support, as well as how you can help your employees from a ICBT point of view. Now, the program that we put together for with AMO and for their members is we're able to implement it within 2 weeks. You do get a account manager, as I mentioned, marketing material and communication, and it is $3 per month per employee. As we look at the different sizes of organizations, municipalities, depending on your size, we do have a little bit of flexibility, but the max is $3, and then we can also discuss any other options. But that gives you a very good idea in terms of the work that we're doing from from the public sector point of view, as well as what Beacon is and how we offer this to Canadians at 20% of the cost of traditional in-clinic services. So on that note, Nick, that's all I have for everyone. I'll turn it back to Nick, but at the same time, here is my information. As I mentioned to you earlier, is if you want more information, as well as the PTSD report that I mentioned, feel free to send me a note, or you can give me a call. But Nick, it's over to you, and we can address any questions.
Thanks, Anthony, and thanks, Colin, for the remarks. Great presentation, a lot to digest there. We've been getting a lot of questions from members about if they can access Beacon through their existing benefits plan provider. And can you speak to that a bit?
Yeah, for sure. Yeah, that's a great question, Nick. So absolutely, people can individuals can go through their own benefits provider, and it's normally under EHC. And what we see from there is, we call that the reluctancy of maybe paying for that service, pulling out that credit card and paying, let's say it's $500. So that's a cost. And the reality is that when individuals have that payroll, they are reluctant to go out and sign up for CBT. So there is that option. But as I mentioned earlier, is that we do see a significant amount of utilization where it's a plan sponsor or a municipality supported, where it's priced per individual. But it is definitely through their own benefits plan. They can claim it.
And maybe I could just jump in here. One of the things that we're certainly seeing with COVID is it's really demonstrated the value that of virtual health services generally, so people aren't able to go in and see their doctor. And we're certainly seeing it on the digital mental health side, and that's why governments are now coming in and having a serious look. What we know is that it's important that people are able to find mental health supports as easily as possible and in as many places as possible. So this isn't necessarily an either or kind of thing. We do have many corporate or commercial or public sector clients who have it available through their benefits. Sometimes benefits are bargained and can be hard to change, or they may have very low levels in them. Sometimes we find that people like to kind of save their benefits in case they want to use them later in the year. And what we know with mental health is the earlier you treat things, the better. The more likely people are going to recover, get back to work, those kind of things. It's like a physical condition. The longer you leave it, the worse it gets. So you want people to have as many spots as possible to find it, and it's easy to get onto it once they are actually acknowledging that they want to get help. And so we do find there is quite a drop off when people finally start doing the assessment, but then they realize they have to put up some money. We hear from first responders all the time that they may not have much room on their credit cards, and then they go through the process, and even if it's 100% reimbursed, there's still a lot of them that it's just those extra steps. So having these things available in many different ways is a really important thing. And then, of course, the other benefit with a subscription model is that you get communications regularly every, well, depending on how often you want it, but monthly, weekly, tied into your Bell Let's Talk campaign, tied into the season of the year, all of those kind of things. And then lastly, I would just say that, there are some people who they don't want to go to their HR department, so they want a third-party confidential service. Some people are reluctant to go to their insurance company, so there's a bunch of different ways of getting people the help that they can benefit from, pre-EAP ideally, although we can integrate with EAP programs as well to refer in and out of them. And then obviously we have our STD and LTD programs as well. But as Anthony pointed out, Beacon pays for itself in reduced absenteeism alone. And then when you factor in a variety of other considerations like presenteeism, it gets up into the double digits, our ROI pretty fast.
Great, thanks, Colin. Question from the floor. When we purchase this program at $3 per person per month, is there still an additional cost to our employees when they sign up?
That's a excellent question. So there is no additional cost to your employee or the organization. It's $3, and they do get a dedicated. There's a code or a website that we do set up. They get we communicate it to the HR department, and then they cascade it down. To all the employees. So there's no additional cost to the employees.
And this covers their families. And I think one other thing to point out is, many people actually have a primary issue, but they may have a secondary issue. So they may have depression as well as anxiety. So when you're in the subscription model, they can do one of the protocols and then they can carry on and do a next one without any additional charge. If you're in the fee-for-service model, or if they're doing it through their EHC, there is a second charge if they do other subsequent protocols.
Great, thanks. Another question from the floor. I gather the therapy is separate from the program.
The therapy is separate from the program. So the answer to that is the therapy is the program. So it's together. So the program, it is together. The therapy, that is the program. Hope that answers the question.
Seeing no other questions right now, I've got a few questions, Anthony and Colin. Can you go into a bit of detail on how a municipality can go about enrolling into the BEACON program?
Yeah, sure. That's a great question. Thanks, Nick. So you can either reach myself through my email address, or else you can go to Nick directly. But essentially, what I need to understand in terms of just currently what you're doing from a mental health point of view, supports, as well as in terms of your population, how many people you have at your municipalities. Then I would give you a good idea in terms of the cost per employee, and then there's also a contract that we'd have to go through. And presently, because we all know that budgets and multiple things that are happening, we are able to do contracts as short as 6 months and as long as 24 months. So there is a significant amount of flexibility. So that's pretty much it's a seamless process. And as I mentioned, that we do have one organization that has come on board already.
I just wanted to go back to that last question, just thinking about it a little bit more, just to make sure that people, so we're a platform, so we're not an app per se. It is a therapist-assisted ICBT, so which is cognitive behavioral therapy, as Anthony said. But what's key in that phrase is that this is therapist guided. So it's not a self-guided offering. And the research has shown that having a therapist who is paired with you, who gets to know you, is very important to sustained recovery. The nature of CBT is that you're reading psychoeducational material, you're setting goals and objectives. So you're actually working with your therapist, but it's in an asynchronous relationship. So you're able to work on things on your own time. So when we say that it is, the therapy and the program or the platform, they're interwoven, and it's important that you actually have the guided part of it, the therapist part of it, as an integral part of the skill building, the coping. Your therapist can check in on you, you can ask them unlimited questions, and like I say, they get to know you, so they can work with you, and they can bring in things all through the course of therapy that are customized to you as needs arise.
Thanks, Colin. There's actually two questions that kind of followed up from that first question from that individual. It was mentioned employees claim the therapy through our benefits, the program costs, it offers other wellness options in therapy.
Sorry, can you just repeat that, Nick?
So the person that's asked that question that's about, let me just see here, the therapy separate from the program, they followed up with two further remarks here. It was mentioned employees claim the therapy through our benefits, the program costs, it offers other wellness options and therapy.
Employees can claim the therapy depending through their benefits, depending on the provider that you have. We do work with all the major carriers. What I was mentioning though is that in some circumstances, the level of benefits in your, it depends on how they're defined. So it could be counseling services. Sometimes people want to keep their benefits for face-to-face if they feel they need that or something like that. So what we're saying is that by having the employer provide a subscription program, it is there all the time available for them. It's communicated, you know, sometimes people have to hear about it 7 times before they are ready to actually access it. Anthony mentioned that we have a Stronger Minds offering out there right now. It's not therapy. It is guidance. It's COVID specific. It gives people you sign up, you set up an account, it's free. You can access videos and information from our counselors, but it is not therapy. And it is specific to the COVID period. You could go on to mindbeacon.com right now and you could sign up for that. So hopefully that answers those questions.
Yeah. And I would suggest the person that asked that question to follow up directly with Anthony at the conclusion of the webinar, and maybe you can get some further clarification through that. So no, thank you for the question, and thank you for the answer, gentlemen. Another question from the floor: what kind of analytics can you provide the municipality once the program is underway, i.e. usage?
Yeah, so that's a great question over there. Is we do provide aggregate information, but it really depends on how many people are obviously using it, because we want to keep privacy and confidential at utmost importance, but we do provide, you know, the usage from the start, how many people have, you know, just the numbers from a perspective of how many people are, you know, logging in terms of, from that perspective. But depending on how big your municipality is and what the utilization rate is, we can assist in that. But we do provide a significant amount of analytics for the organization. Particularly, you know, we want to ensure that you know, they're getting the information that they need, as well as what the challenges, the common challenges, are there commonalities amongst their groups. So absolutely able to provide you a significant amount of information.
Yeah, the advantage of this program is, you know, some of you come from smaller municipalities who small enough that may not generally be able to access the type of pricing. And so this program pools people together and provides data insights back. As Anthony said, you know, if there's less than 20 people using a program, we really can't provide data that is specific to the organization without causing some privacy issues, but we can provide data pooling the municipalities together that can be very insightful as well with trends and things like that.
Great, thanks. A question from me, and this is an issue that's near and dear to I know the policy team of AMO's hearts and a lot of smaller communities across Ontario. But it is a digital platform, Beacon, and there are members out there that have connectivity issues in terms of access to high-speed internet. Are there any alternatives to accessing Beacon, for example, like through a phone call, or is it predominantly through a digital means?
Yeah, that's an interesting question. You know, this program is a digital program. We do provide services by video. It would be a different pricing kind of model. With COVID, you know, we've been able to provide that all across the province, phone and video. As I mentioned, we have our network of clinics called CBT Associates. So that if people are actually wanting some, we call that virtual services as opposed to the digital, certainly by all means get a hold of Anthony. during this period, we have actually added those kind of services for employees at one of the major hospitals, for example. They've gone with exactly that kind of service.
Okay, great. Thanks, Colin. I have one more question, and we've been getting a lot of inquiries from public health staff across Ontario. I'm just wanting to make sure that they too have access to the BEACON program under the AMO agreement.
Sorry, when you say public health staff, are they the ones who are actually employees of municipalities, or the ones who...
Correct, yes.
Yeah. I mean, any employees of municipalities are eligible for these programs in this pricing.
Okay, great. Thank you.
And as Anthony mentioned, we're also adding some frontline worker, healthcare worker, first responder content as well. Today we started with correctional workers, but we have worked. We've got lots of work that's been done with paramedics and a variety of other types of groups as well. So yeah.
Okay, great. Thanks. I don't see any other questions being sent in here. So I guess with that, I think I will start wrapping things up. Oh, there's one more question that came in. We are a public health unit, but not a municipal employee. Does this make a difference?
Why don't you give us a call and we'll sort it out. We just need to figure out where there might be some alternatives that are available, and how we would ask provide supports for you.
Okay, great, thanks. A further question here, would this subscription program be separate from the municipality's benefit program, for example, Manulife?
Yes, that would be, yeah, this would, the BEACON program that we have would be separate from your benefits program with Manulife. As I alluded to earlier, is the common one that people look at is EFAP. This would be on top of EFAP, and as I said earlier, it is very much focused to mental health.
Great. Thanks, Anthony. Okay, so I'll wrap things up now. If members are interested in the BEACON platform and how it can help, by all means, please reach out to Anthony. His contact information is there, and so is mine if you need further information about the AMO BEACON partnership. We will be promoting this partnership with further details on how to access it. So please stay tuned to our channels for further information on anything related to the AMO BEACON partnership going forward. So thank you. So that concludes our webinar. We will be posting a recording of this on the AMO YouTube channel. And if you've enjoyed what you've heard so far, please click subscribe on our YouTube channel to receive the latest updates on the activities of the association, as well as past AMO webinars and updates from the AMO president on the work of the board of directors. And I know that through that YouTube channel, there are a lot of excellent COVID-19 resources that you can access as well too. So thanks again to Colin and Anthony for the presentation, and thank you all for listening and participating today, and take care and be well, everybody.